Hi, this is Brandon with ChiroUp. I want to go over a quick thing that I learned that has transformed my practice. And that is, not only do we need to use clinical prediction rules and simplified ways to be efficient and effective in practice, and the best way to do that is to classify conditions. Meaning, if we're looking at lower back pain, we don't diagnose somebody with lower back pain. We say that they're directional preference. They need traction, they need manipulation, they need stability. Finding those treatments that will work for that specific subtype of back pain. We do that all the time. It helps us get the best results possible. But one thing that I think is lost is classifying the patient. So not only do we have a bucket for the diagnosis and classifying what they need as far as the treatments, but we also need to figure out the goals and the needs of our patients. And that's where classifying the patient comes in. There's a great new paper by Hester et al. Came out this year on classifying patients with SLAP lesions. And I love this paper because SLAP lesions are unfortunately very, very common, whether it's a young or an old patient. But we need to understand the needs and the wants of that patient before we can even understand which treatments to provide for that patient. Now, here's what we know, that if you don't have instability, and instability is gross movement of a joint, where the joint feels like it's translating, it's moving forward, you can use a joint relocation test or any other test for instability, or if there's been a significant damage or trauma to the shoulder. But let's take, for example, a patient who has a SLAP lesion, but they don't have instability. What we know is that 2/3 of those patients respond to conservative management. That conservative management is scapular stabilization exercises and restoration of balance of the muscles around the joint. There's nobody better to treat that. We are it. Chiropractors should be the #1 people you should see for a SLAP lesion right off the bat. We can assess for all the different ranges of motion and make sure that person can get back to their sport, their activity, their hobby as fast as possible. But there's different subsets of those patients. The next one is that they do have a trauma, and they do have instability. What should we do with those patients? Well, as it turns out, if they're less than 40, we really should do a SLAP surgery to that person to tighten up that joint. If they're above 40, there's other surgeries we can do, like repairing the biceps tendon. Now, if they just have an overuse injury due to their sport or their activity, but they don't have any signs of instability, this third group also responds well to conservative measurements. But if they do have a history of an overuse injury, they were a football player who was a quarterback for several years, they have a repetitive stress injury where they're a baseball pitcher, then we should also consider repairing that biceps tendon to tighten up that joint, and that'd be best assessed with an orthopedic surgeon. The fourth group are throwing athletes, and those throwing athletes are usually our younger patients, and they should be in their own category to begin with. Those patients have very different needs and wants, and they should also 100% go through scapular stabilization exercises. They should also go through hip stabilization exercises. What we know is that 50% of your power, especially with an overhead athlete, comes out of the opposite hip. Make sure you're addressing that. And then we should also look at core stability exercises to help create a nice firm foundation so we can have good distal mobility. We should do all those things before we even consider surgery with these patients. To keep them in their sport, keep them active while you're improving the stability of the joints and the muscles around it are the #1 thing we should do for those patients. So, a recap, we should absolutely fill our buckets with diagnoses and make that diagnosis as specific as possible. But even once you have a diagnosis, don't forget about the needs and the wants of the patient. Now you need to classify their patient on what they want and what they need to do before considering which treatments or referrals need to be made. I hope this helps. Take a look at the blog. I've also included the condition reference that we use for SLAP lesions in our office to improve scapular stability and core stability to help these patients get out of pain quickly and get them back to their sport.